Hello, my friend. Welcome to Dr. Health Hub, where every episode begins with a doctor's tip you can trust. Today's topic, cervical cancer. It sounds scary, I know, but stay with us. We're going to keep it clear, simple, and hopeful. By the end, you'll understand what cervical cancer is, why HPV matters, what signs to notice, how doctors test for it, and most importantly, how to prevent it. Doctor, let's start very simple. What exactly is cervical cancer?
Cervical cancer begins in the cervix, the small lower part of the uterus that connects to the vagina. It usually starts with tiny cell changes. Over time, if those changes aren't found, they can grow into cancer. The good news is, when caught early, it's one of the most preventable and treatable cancers.
So it grows slowly. That gives us a window, a chance to stop it.
Exactly. That's why regular screening is so powerful.
And the cause, what pushes it to happen?
The main cause is HPV, human papillomavirus. It's very common. Almost everyone who is sexually active, men and women, will get it at some point. Most of the time, the body clears the virus, but sometimes it stays, and certain high-risk types of HPV can lead to cancer.
So HPV is the driver. Almost every case is linked to it.
Yes, that's why prevention is possible.
If HPV is so common, does everyone who gets it develop cancer?
No, most infections go away on their own. Only a small number become long-term and dangerous. But since we can't predict who will clear it and who won't, screening is essential.
Let's talk about that. What exactly is a pap smear?
It's a simple test. A doctor or nurse gently collects cells from the cervix and checks them under a microscope. Not painful, just a bit uncomfortable, but it can find abnormal cells years before they turn into cancer.
So it's not just finding cancer, it's stopping it before it begins.
Exactly. And today, pap smears are often combined with HPV testing. That tells us if high-risk virus types are present.
And when should women begin screening?
At age 21. From 21 to 29, a pap smear every 3 years is enough. From 30 to 65, women can do a pap every 3 years or a pap plus HPV test every 5 years. After 65, if results have been normal, screening can usually stop.
That's very clear, and it shows why routine checks matter so much.
Yes, in countries with strong screening programs, cervical cancer rates have dropped dramatically.
Now, symptoms. What should women watch for?
Early stages, usually no symptoms. That's why screening is critical. When signs do appear, they may include unusual bleeding, after sex, between periods, or after menopause. Other signs include unusual discharge, pelvic pain, or pain during sex. In advanced stages, there may be back pain, swelling in the legs, or weight loss.
So waiting for symptoms is dangerous.
Exactly. By then, it may be advanced.
Now let's turn to hope. Can cervical cancer really be prevented?
Yes, and prevention is powerful. The HPV vaccine is key. It protects against the virus types that cause most cervical cancers. And it's not just for women. Men benefit too. The vaccine lowers risks of anal, penile, and some throat cancers. When both boys and girls are vaccinated, the virus spreads less. The whole community becomes safer. The CDC recommends starting at ages 11 or 12. It can be given as early as age 9. If started before age 15, 2 doses. If started later, from 15 to 26, 3 doses. And it can still be given up to age 45 if missed earlier.
That's amazing. So it protects the individual and protects others too.
Exactly. At regular Pap smears and HPV testing, they catch changes early. Safe sex lowers risk. Condoms help, though they don't block every type. Not smoking matters. Smoking weakens the body's ability to clear HPV. And for pregnant women, early testing is especially important.
So the prevention package is clear: vaccine, screening, safer choices, and healthy habits.
Yes, together, these steps make cervical cancer one of the most preventable cancers.
Let's tackle some myths.
Myth: only women with many partners get cervical cancer. Fact: any woman who is sexually active can be at risk. Myth: Pap smears are painful. Fact: they may feel uncomfortable, but they are quick and safe. Myth: if you feel fine, you don't need screening. Fact: early stages have no symptoms. Screening is still needed.
That clears up so much confusion.
Yes, knowledge reduces fear. And when fear drops, women are more likely to get tested.
Doctor, before we close, could you give us a short recap?
Cervical cancer is almost always caused by HPV. It develops slowly, so we can stop it early. Pap smears and HPV tests save lives. The HPV vaccine protects both women and men. And prevention is always stronger than treatment.
Thank you, doctor. That was clear and full of hope. And thank you, my friend, for joining us on Dr. Health Hub. Don't forget to like, share, and subscribe for more trusted health education. And remember, your health is your wealth. Better health starts here. Stay tuned for the next doctor's tip you can trust.